Welcome back to Doc Hobby 2020. Please participate in the polls that appear on top right of your screen. For social message, please go to last 1 minute of the video. Today's topic is G6PD deficiency. Before we go to the topic, agree with me that medicines are to be taken with doctor's prescription only. Here we have a 16-year-old baby boy who was seen to have yellowish discoloration on blanching skin under bright sunlight. Let us not be surprised because yellowish discoloration is most of the time physiological because of high red cell mass with little lifespan, which is likely to be destroyed rising enough levels of bilirubin in the blood, manifesting as jaundice. You may point out liver is there to take care of. Maybe ours, but in first few weeks of life, ligandin levels are low in hepatocytes to take up bilirubin. Even if it manages to take up, enzyme needed for its conjugation is low, so unconjugated hyperbilirubinemia is mostly physiological. Even if it gets conjugated and excreted in bile, it is reabsorbed significantly due to increased intestinal transit time. Let us discuss differences between physiological and pathological jaundice. Physiological jaundice appears on second or third day and not within 24 hours. Conjugated hyperbilirubinemia tends to be pathological. Discoloration of limbs usually needs therapeutic intervention. Deeper the yellow color, more it is likely to be pathological. Transcutaneous bilirubinometry is not reliable because jaundice appeared within 24 hours of birth. Baby delivered a term with good birth weight. Blood group of mother and baby are O positive, so there is no question of Rh isoimmunization. Investigations confirmed unconjugated hyperbilirubinemia, hemoglobin, hematocrit, haptoglobin are decreased, and reticulocyte count, LDH, and tidal carbon monoxide are increased, suggesting intravascular hemolysis. Peripheral smear detected polychromasia, suggesting increased hematopoiesis. Bite cells and Heinz bodies on supravital staining suggest denatured hemoglobin. Direct antiglobulin test is negative, ruling out immunohemolytic anemia. Nomogram when plotted suggested for therapeutic intervention with phototherapy. Butylet test is positive and spectrophotometric analysis showed 40% of G6PD activity, suggesting G6PD deficiency. Baby covered in diaper and eye patch is placed in bassinet with reflective material around under chlorofluorescent light of blue and white with lamp at distance of 40 centimeters. Total serum bilirubin, temperature, urine and fecal output, specific gravity and weight are monitored. Advice includes continuing breastfeeding. Phototherapy will be over if 2 consecutive bilirubin levels show normal values. And need for exchange transfusion should be explained if bilirubin levels do not fall. Regular postnatal visits, diabetes risk, diet free of fava beans, should report to doctor immediately if sick, and G6PD deficiency should be mentioned in history of chronic diseases. Let us discuss G6PD deficiency. Mutation of G6PD gene on chromosome X results in deficiency of glucose 6-phosphate dehydrogenase, resulting in decreased reduced glutathione, which makes red blood cells susceptible to oxidative damage by oxidants released during infection or drugs. Oxidative damage results in precipitation of hemoglobin forming Heinz bodies that damage RBC, resulting in intravascular hemolysis. Heinz bodies are plucked out of RBC by macrophages forming bite cells, which get trapped in spleen when recirculated, causing extravascular hemolysis. Clinically significant classes of G6PD deficiency are 3 in order of decreasing severity, and our patient comes under class 3. In G6PD A- variant, enzyme has reduced half-life with older RBC, more susceptible to hemolysis due to oxidative stress. Here comes the social message. Jaundice for you to understand is yellowish or greenish yellow discoloration of white of eye and skin, which can be assessed by you in your baby after his discharge from hospital by bilirular device or BiliCam smartphone application, and both does not seem to be currently available for sale. If you get your hands on them, do me a favor by commenting how to access them. I already contacted their developers, but I am not lucky enough to receive their reply yet. Sunlight can cause sunburn to baby but will not treat your baby's jaundice. Feed child with breast milk adequately because it is known to decrease risk of jaundice. Social message on advice of breastfeeding will be in the pop-up above. If you are diagnosed with G6PD deficiency, avoid fava beans, strictly take medicines only after consulting doctor, and visit doctor immediately if you get sick. Comment below, share to the relevant, like and subscribe for future videos. Thank you.